is a plant-based or alkaline diet best for the treatment for cancer? We get that question a lot. Should I go on a keto diet? Because, oh my gosh, I read this book on keto diets and cancer. Should I go on a plant-based diet? Should I not do any animal protein whatsoever? Or should I become a vegan or a vegetarian? Is that the best thing? Should I go on an alkaline diet? Is that the best thing? The truth is that cancer needs the growing cancer. So cancer is cells in rapid replication. That means they're highly metabolic, means they're very hungry. So they're looking for a fuel source. Is that fuel source always strictly glucose? The answer is no. Sometimes it's not glucose. Sometimes it's glutamine and serine, and those are different amino acids that are from protein. So a person whose cancer is driven mainly through amino acids, that is the main fuel source, then yes, a plant-based diet would be best for that person. But a plant-based diet, let's say a typical like Gershon juicing, I'm going to start juicing right away. Well, juicing can be high in glucose. So if your cancer is fed mainly through glycolysis, through the breakdown of glucose, then that might not be the right diet. How do I know? Because there's these extreme ends of ketogenic, which is very, very low sugar, very, very low glucose, but maybe higher on the aspect of proteins, versus a juicy Gerson type diet, which is very high in glucose. So it's very difficult to know which diet is best for you. So in our clinic, we test for that. So, but let's say you don't come to our clinic, how do I know what diet is best for me? There is some data out there on metabolic typing. That's what Dr. Gonzalez used to do, is do metabolic typing, and he did produce some literature on that you can take a very long questionnaire and get an idea of what could possibly be fueling your cancer. We have found that to not be extremely effective in knowing what can fuel my cancer. Also, the struggle with that is that cancer is constantly trying to survive and find a fuel source. So if your fuel source in your cancer is mainly glucose, and you go on a ketogenic-like diet, don't have to necessarily get totally into ketosis, but if you go on a ketogenic-like diet, and you're starving your cancer, that's the goal. But your cancer can switch quite easily because it's trying to find a fuel source, and it can be fueled through a different pathway. So diets for cancer patients may need to switch over time. So if your cancer is fed mainly through amino acids and you cut down on the animal proteins and you find that your cancer is starting to go into remission, and then 6 months later it starts to take off again, what's the matter? I've been staying on my diet. It might be because the fuel source switched. So if you're not a patient of ours and you don't have a way to find out what's the best diet for me, maybe a balanced diet, meaning low in animal proteins, doesn't mean you're going to go off them completely, and get rid of all your simple carbs and try to get on a low carb diet. That is what we call a mixed diet. Most people that we test, honestly, test positive for dairy being a driver for cancer. So I would suggest, in general, dietary, cutting out dairy or cutting down dairy to a minimal is beneficial. And it really has to do with the sort what dairy is. And we're talking about what comes out of a cow's udders when we're talking about dairy. What dairy is to make a baby cow grow quickly and gain weight quickly and become an adult cow. So it has growth factors in there, it has hormones in there, it has all sorts of other impurities in there as well. Even organic dairy still has hormones and growth factors in it because that's what dairy is supposed to do. So that, I would say, in general, is the right diet to do. But if you don't have a way to test it, the only way to test it really is to try one of these diets and see if it slows your cancer growth. Of course, you have to have some at least subjective or objective data to be able to measure if you're slowing the cancer growth. But that's one way to do it, is try a diet, see how you're doing. You're doing real well. You feel like you're in a relative state of remission, then stay on that diet. If things change and your cancer wakes up and starts growing again, then think about switching diets, because it's looking for a fuel source.